Hi there, Kathleen. How are you doing today?
I'm fine. Thank you for inviting me.
Of course. So, if you could just quickly introduce yourself for us, your name, your title, a short bio about yourself, your credentials, and then please state the title of the article you'll be talking about today.
Okay. All right. My name is Dr. Kathleen Neville. I am the Associate Dean for Graduate Studies and Research here at Seton Hall University College of Nursing. I have been a nurse for many, many years. I started my career as an adolescent oncology nurse in New York City. I then shifted and focused my direction into nursing education. I got a master's in nursing education from NYU, and I really fell in love with the conduct of nursing research. So I quickly pursued a PhD in theory development and research in nursing. So I've done a lot of research. I started doing research on adolescents with cancer because that was my clinical background. I've conducted research on the psychological aspects of having a diagnosis during childhood and adolescence. And then I transitioned after years. I started investigating substance abuse and opioid use and started off really looking at nurses' perceptions of people with substance use disorders back in 2014. The title, so since researching that, I'm the principal investigator on two substance abuse and mental health services administration grants. So I've been helping train medical students, nurse practitioner, and physician assistant students, both at Seton Hall, Monmouth University, and Hackensack School of Medicine, for these students to learn how to prescribe medication assisted treatment for opioid use disorders after graduation. And I became very interested in the xylazine as an additional adulterant. First, we had fentanyl. Now we have xylazine. So the title of my article is "Infiltration of Xylazine in illicit fentanyl." So we've got two adulterants. Everything's been, heroin's been replaced essentially.
Fantastic. So, could you just briefly give an overview of why nurses should read this article?
Well, I became really fascinated with xylazine last year. I met with the US drug czar, Dr. Rahul Gupta, and we started talking about adulterants and fentanyl. And it was about last February that I started reading about in the New York Times about this new adulterant, which is a veterinarian drug essentially, that xylazine was really, it's like epidemic proportions in the United States. And nurses need to be aware of this because it is very, very dangerous. It's infiltrated the illicit drug supply. I mean, first we have fentanyl, now we've got Xylanol and fentanyl. I think the Harris Biden, our leaders, have said that this is the one of the largest emerging threats for the U.S. public health system. So it's really very dangerous, and nurses need to know about it. They need to recognize it. When a person is overdosing, we know that with fentanyl, we know that if you give them Narcan, they will respond. But so many people are using both fentanyl with xylazine and they're not responding. So the opioid is counteractive, but the xylazine is not. So people, that's called, they call it trank, they call it zombie drug. It's because people are not responsive. They can have severe respiratory, cardiopulmonary events, and it's a very dangerous drug, and people need to recognize that, and that's what nurses need to know.
It makes a lot of sense, and with such an important topic, obviously something must have like drove you to write this article specifically. Was there a moment that really made you want to write something about this really important topic?
I'd have to tell you that, when I was a nurse or a nursing student, I would rotate through a burn unit. And I used to think that burn injuries were the most horrible. With a severe burn, you form eschar. It's like this black leathery uh, coating on top of the skin that has to be removed because the skin will die underneath it. So I started reading about it's somewhat difficult because we don't understand the rationale, the etiology. But people who use xylazine now are developing these horrible necrotic dead tissue wounds, not only at the injection site. So, you could take xylazine orally, but most often it's IV. So it's, you see people who have been using, when I was a practicing nurse, I now in academia, but I used to see people who would be injecting and abscesses and cellulitis at the site. But with xylazine, it could be anywhere else on the body. And they are horrible, horrible wounds. So, very often you're talking about homeless populations on top of all their addictive disorders, going through withdrawal and the cravings. Now they've got these horrible skin lesions that could really be a cause of death. So that's what really impassioned me to write this article, because no one really knew about it. So when I wrote this article months back, it was, and it's still, people don't know about xylazine. It was in the news frequently, and now it's not so much in the news. But nurses in every clinical setting are going to see it.
Well, since nurses in every critical setting are going to see it, if you had to zero in on 2 to 3 key points that you want to make sure sticks with them when they read this, what would those key points be?
I think the first key point, and this is what I've been working on with these grants, that people with opioid use and substance use disorders, we need to recognize it as a disease. It's not a moral weakness. Addictive disorders across all levels of socioeconomic status, across all groups of people, and it is very, very stigmatizing. I just recently came back from Scotland. I was a Fulbright scholar doing research on the opioid epidemic in Scotland. And I was studying nursing students. They don't have the stigma that America has. And even though they have an epidemic, people are far more compassionate of the people I studied. They have more empathy, more compassion. Here in the United States, we still hold a lot of stigma. And many people still think about people with addictive disorders as it is a moral weakness. They could stop if they want, but it's really a disease. It is a chronic uh, brain disease and another point I'd like to bring back is it's capable of recovery. People do recover. They may need multiple times at rehab, but we are seeing people who recover. So there needs to be, I think, a change in view towards people with addiction. That would be my most important message. I think another view is that with education, if you really, it's mandatory in nursing, medical school, PA programs that education be provided on substance use disorders. It's a required curricular content. With that education, perceptions do change. So I like to think, even though the opioid and substance use epidemic is getting worse, with more education, with more knowledge, I like to think it will change.
Well, that's good. And thank you again for writing this article for us. I know it's such an important topic, and for you to write something like this for us is we appreciate it a lot. So thank you again.
Oh, you're very welcome. Nice meeting you.
Nice meeting you too. I hope you have a fantastic day.
You too. Bye now.